feeling well.
Okay. And Delegate, I just wanted to make sure Delegate Lewis Young was here because her bill's first.
Yeah, so everyone else is here except for her, so that the voting is accurate. Okay, welcome to the House Health and Government Operations Committee. This is the Public Health and Minority Health Disparities Subcommittee. The chairman of the committee is Delegate Shane Pendergrass, and I am the chairman of this subcommittee, Jocelyn Pena-Melnick, and I want to thank our wonderful members for being flexible. I know that the time of these meetings, we need to be flexible because a lot of us are in different subcommittees and this is crossover. But I want to take a minute to thank Erin Hopwood, who is our counsel and who's just amazing for all the work she's doing and putting up with all of us. And thank you, Erin. And thank you, Ms. Edith Perry from my office, who's staffing this meeting as well, okay? So I know that I don't want to hold people that are here for House Bill. What is the House Bill number, Erin? The
1020?
No, the one that I had, there's some people for the cannabis one.
Oh, 1078. So that the website.
Yeah. House Bill 1078, we're not going to do it today because there was a question about the age requirement and there's a way to do it. And we have the Senate bill. And frankly, if the Senate bill passes, that I'm fine with that. So we're gonna just hold that. I don't wanna stress Erin out in doing that amendment, okay? So those of you that were here and I saw a few for that bill, I apologize. I hope that you're okay with it, that we want to get it right, okay? So thank you for being here. So we're going to start in the following order. And those of you that have been here for the last 3 days or so, thank you so much for being patient. We're going to start as promised with House Bill 1020, then followed by 699, 1188, 1370, 1381, and 1389. So the way it works in this subcommittee is that Erin will describe the bill. Then if the sponsor is here, I let you tell us why it's needed. Then I open it up for the advocates in the subcommittee for questions. And I don't like surprises, so I allow our members to ask as many questions as they want. And sometimes when we need to hold it, we hold it. So let's get started with House Bill 1020. Developmental Disabilities Administration Self-Directed Services, Self-Direction Act of 2022. Erin.
And there's a reprint of this bill that starts on page 40. You received like 2 packets. It was the start of packet 2. If you go to handwritten page 42, it redefines individual directed and family directed goods and services. And then there's similar amendments to individual directed and family directed goods and services that are amended on page 43. It also amends the definition of person-centered plan of service, and that's line 10 on page handwritten 44. The crux of the bill starts on, sorry.
Is it page 46?
For services and supports.
It also,
have you got
so it's a lot of definitions.
Hold on a second. Hold on a minute, Erin. Delegate Lewis, will you be so kind and mute?
Oh, sorry.
It's okay. It happens.
Out loud.
It's okay. It happens. Erin, go ahead. I'm sorry. Go ahead.
So really the crux of the bill begins on handwritten page 48. That requires the Developmental Disabilities Administration in consultation with stakeholders to establish and provide training materials to coordinators of community services, specifically on the self-directed services model of receiving services, including training materials on self-directed services, procedures, policies, and resources. And then as part of the process of developing a person-centered plan of service for a recipient, a coordinator of community services is required to educate the recipient on all models of service available to the recipient, including self-directed services, traditional services, and provider-managed services, to assist the recipient and the recipient's family or representative in making an informed choice on which services the recipient would like to receive. The bill also requires the administration, if you go into line 16 of handwritten page 48, requires the DDA to provide to a recipient who receives self-directed services, individual directed and family directed goods and services in an amount based on the recipient's needs and included in the recipient's person-centered plan of service as calculated on an annual basis and within limits of the approved annual budget generated by the department's long-term services and support software system or its replacement system. The administration would also be required to provide access to the recipient's plan of service and budgets for the plan of service through the department's long-term services and support software system, and up to, and it says 40, but that's been amended to up to 30 hours of support broker services each month as needed by the recipient and within the recipient's total approved annual budget. An option for a family member or legal guardian of the recipient to provide services to the recipient if the recipient or an individual authorized to make care decisions on behalf of the recipient chooses the family member to provide the services, and the recipient also hires a support broker. And 49 now. The DDA would also be required to provide reimbursement paid on a per mile basis to the owner of a specialized, modified, or accessible vehicle driven by an employee of the recipient and for the purpose of the recipient engaging in activities specified in the recipient's person-centered plan of service. The bill also requires a budget for self-directed services that provides the ability to use funds from the recipient's approved annual budget for the purpose of funding at least one position to assist the recipient in managing the recipient's home, staff, and other administrative duties. The bill also requires an option for a recipient who has a demonstrated need for overnight supports provided through personal support services carried out using the recipient's employer or budget authority to direct and choose the employee, vendor, or provider of the overnight supports. The amendments also require, if you go on to the bottom of page 40, handwritten page 49, they require provide the administration may not establish a limit on the dollar amount of individual directed and family directed goods and services provided to a recipient or the number of hours of personal support services provided. Provided to a recipient who receives self-directed services that are necessary for the health and safety of the recipient and are authorized by regulations adopted or guidance issued by CMS under the Social Security Act. The amendments also provide that a recipient may not receive services or supports in excess of the recipient's annual approved budget. Moving on, this is in line 6 of handwritten page 50. There's also language requiring DDA to provide up to 40 hours of support broker services each month. Again, there's a amendment later in the packet that would reduce that to 30 hours of support broker services each month. The bill also has some special section language that requires DDA to submit to the Centers for Medicare and Medicaid Services an amendment to the Community Pathways Waiver that would include the overnight supports requirements of the Act. It also requires DDA to report to the General Assembly on the process of implementing requirements established under the Self-Directed Advocacy Network of Maryland's recommendations. And it also has some federal funding language saying that DDA would leverage federal funding to pay for the services provided in the Act. The additional amendment on page 51, handwritten page 51, that is the amendment that would reduce the required hours of support broker services from 40 to 30. And then there is a handwritten amendment on page 52. This is some reporting language that would require MDH to collect utilization data on recipients of self-directed services and determine the fiscal impact of expanding services under the bill, and on or before January 1st, 2023, provide a baseline report to the General Assembly on the utilization and cost of self-directed services. It also requires that on or before October 1st, 2024, MDH would provide a report to the General Assembly on the department's findings and recommendations on the expansion of self-directed services as required under this bill.
And if I may, I actually talked to Heather, who's on this call, about that language and on channeling Delegate Shalega. We need to get the report on these things, especially because there was a question on the, on the fiscal note. And I wanted to make sure that what it actually is so that we can get a report, right? To see if we need to fix something or make any adjustments The 40 to 30 hours is also to reduce the fiscal note as well. And the other reporting in there so the committee can have it. So why don't you, Delegate Lewis Young, go ahead and nice and short because we have a lot to do.
Okay, why is this bill important? People with developmental disabilities frequently have no alternative but to be institutionalized. And what this bill does is give them access to a federal program called self-direction, where they are empowered to have input and direction on the support services for their life. And there isn't anything that we've asked to do that isn't part of the federal waiver. One other thing I would add that reduces the fiscal note is that we've taken therapies out of it. And we also repeatedly have the phrase within the total annual approved budget. So if an individual has a budget, they can't use it or certainly not exceed it without the approval of DDA. Now, I know some of you may have heard they can, but the same way we fill out expense reports, I can put in for $100. The computer will let me, but finance isn't going to approve it. So an individual must stay within their budget because DDA has to approve it. And therein lies the crux of the problem, which is why we're here today. DDA has not been approving services that are within the individual's budget. This legislation is intended to fix that problem. As our chair mentioned, there are some fiscal note debates, but her amendment certainly will examine that and keep that in order. Thanks once again for the opportunity to come before you. I appreciate it. And to the people on this subcommittee that served in the work group, thank you so much.
Okay, Heather.
Thank you, Chairwoman. I don't really have anything to add. I think the amendments will help us figure out the true fiscal impact of this and if any adjustments need to be made in the future. I spoke to Delegate Lewis Young a couple of days ago. We've been working on this, and I did just want to correct for the record. I had misunderstood. I shouldn't say the department, but also myself had misunderstood the intent of the legislative work group that we had previously had. And so the intent of that was to come to an agreement. And so I just wanted to correct the record that she never promised no legislation. And so I told her, I apologized and said I would absolutely correct that for the record. So I just wanted to put that out there. But other than that, thank you. We appreciate the amendments. We look forward to working together on this. And, to be continued, we'll keep moving forward on this, and we look forward to great work. So thank you.
Thank you. And I want to thank you because you took my call really early in the morning because yesterday, I think it was, because I was trying to work on this bill and you have always been, always there every time I call you, whether I call you, whether I email you. I just want to publicly say thank you, okay? Because we have a
Thank
good
you.
working relationship and I do appreciate you, Heather, okay?
Thank you.
My pleasure. So are there any advocates that want to be heard on this bill quickly? Okay. All right. Seeing none, the committee, any questions on this bill, or may I have a motion for the amendments?
Move the amendments.
Second.
Any discussion on these amendments? All right, seeing none. All those in favor of the amendment say aye. Any
Aye.
opposed? Seeing none on the bill as
Move the
amended.
bill.
Second.
Thank you. Wonderful. Any discussion or concerns on this bill, anyone? Seeing none, all those in favor say aye.
Aye.
Any opposition? The bill passes with the exception of the one delegate that is out, that is excused, okay? Thank you so much to Delegate Lewis Young for your patience, for your work. Heather Scheck, thank you so much for making yourself available. And to all the, self-directed advocates, thank you for your patience and for the work you're doing, okay, to help people that are the most vulnerable in our state. So thanks so much.
Thank you for hearing us.
Oh,
Thank you.
it's our pleasure. The committee cares. Thank you. So next we have House Bill 699. And 699 is Office of the Chief Medical Examiner Grief Counseling Services. And we held it because the sponsor was working on it. So I would like Erin to describe what the bill does, and then I would give the sponsor a few minutes, and then we'll open it up for discussions. Thank you.
There's a reprint of this bill. It starts with handwritten page 1. It was in the first packet that I sent today. And actually, I need to just clarify on handwritten page 2, the only thing that will stay in the bill is lines 7 through 9. And this would require OCME to include resources and educational material on grief related to suicide and substance use overdose deaths on their website. So lines 1 through 6 should be stricken, and lines 10 through 19 should be stricken.
Thank you.
Then moving on to the bill, handwritten page 3, this would, lines 28 through 30, this would be a new authorized use of the opioid restitution fund to support the Office of the Chief Medical Examiner and the Behavioral Health Administration in providing grief counseling services and resources on grief. And then if you move on to, I didn't do a handwritten page 4, after line 26, there is a work group that's created by the bill. It's the University of Maryland School of Public Health in consultation with the Behavioral Health Administration and the Maryland Psychological Association to convene a work group on programs for survivors of traumatic grief. And then subsection B would, that lists the members of the work group. And if you move on to subsection D on handwritten page 5, the University of Maryland School of Public Health would provide coordination for the work group. The work group's charge is in subsection G, and they would be required to make recommendations for model programs for survivors of traumatic grief. And in making the recommendations, the work group would consider and make recommendations on the potential uses of the opioid restitution fund to improve the reach and quality of traumatic bereavement care and post-intervention efforts, and may consider and make recommendations on the following issues and other issues relevant to ensuring the provision of services for survivors of traumatic grief. They could look at OCME staffing levels, including compliance with existing staffing requirements, program evaluation data from medical examiner affiliated bereavement programs in the state and across the country and national post-intervention programs, data from any needs assessment conducted in the state that focused on survivors of traumatic grief and their interactions with OCME, and the development and evaluation of potential pilot programs executed by the academic facilitator, which would be the University of Maryland School of Public Health. The work group would report their findings and recommendations to the General Assembly on or before November 1st, 2022.
Okay, thank you. So Delegate Lehman, go ahead.
Thank you so much, Madam Chair, and I will try to be brief. Delegate Pena-Melnick and I actually, the last few years, have had 2 constituents who have lost children to suicide. One was a 14-year-old freshman at Laurel High School, and the other was a 24-year-old recent UMD grad. Both of us saw what the parents went through, and we have been in continuous conversations with them. The young woman at Laurel High School who passed, that led Delegate Pena-Melnick to do a bill on requirements for guidance counselors around mental health. But I've continued to talk to the parent of the 22-year-old young man who died. And back last summer, he introduced me to some Hopkins researchers that were doing extensive research on providing meaningful bereavement support to, the term they use is death by self-harm, meaning death by suicide or substance use overdose. And they wondered about my thoughts on that. And their main question was, where would we find funding to further this? Not the research so much, but because we're starting to culminate the research, but actually providing meaningful services for people in the community. And the thing I thought of immediately with their mention of substance abuse overdose was the opioid restitution fund, knowing that that fund had been discussed for years in this committee and the appropriate uses of it. So that was the beginning of that conversation. And then the more I talked to folks, and I too shared in the hearing that I lost a brother 11 years ago to suicide. And it just happened that there was this nexus then with the Office of the Chief Medical Examiner with the kind of work that they do there. Obviously, it's very, difficult, very challenging. And then there was this nexus with this severe staff shortage. And it was like 2 or 3 days, I think, after the hearing on this bill about grief support within the Office of the Chief Medical Examiner that the head of OCME resigned. And so in talking to Ms. Hopwood.
Delegate Lehman, I just been told we only have like 10 minutes and we have
I'm
a
sorry.
lot of bills.
So bottom line is that Ms. Hopwood assured me that this would make sense as a use, an allowable use for the opioid restitution fund. But the work group is needed to sort of figure out, the timing wasn't right for actually embedding this staff in OCME given its extreme challenges with staffing. And so that is the reason for the work group. And I'm grateful to the University of Maryland School of Public Health for being willing to work on that. Thank you.
Thank you. Are there any questions regarding these amendment of the bill? Delegate Shalega.
Yeah, I am a little concerned about putting it in the Office of the Chief Medical Examiner. So you're saying we moved it out of there because obviously they're overworked and understaffed right now?
And that's what the purpose of the work group would be, Delegate Shalega, before the resignation occurred and obviously that pressure has been there for a while and the problems for a while, but there are some models for similar programs in the Office of the Chief Medical Examiner. And the idea is that is the first agency or entity that loved ones deal with when they learn of the death of someone from a drug overdose or by suicide. And it seemed like a natural fit, but the work group could come up with different recommendations and say, we don't believe that these programs, they're worthwhile, but they shouldn't be embedded in OCM.
But the question is, right now, the person that's staffing this work group is the University of Maryland School of Public Health in consultation with the Behavioral Health Administration and the Maryland Psychological Association. The Chief Medical Examiner is only a member, correct?
A single member, yes.
Yes,
Yeah,
okay, they're not
we
staffing it.
Maybe you should change the title of the bill. Just a suggestion.
The title might change when the amendments go through.
Okay.
Yeah,
I think that would be helpful.
It has to match the substance of the bill.
All right. I think that people on the floor who follow this medical examiner
That's a great idea.
have problems with the title. Thank you.
Yeah.
No, thank you. Great suggestion and great question, Delegate Shalega. Any other questions regarding this bill? Delegate Hill.
Thank you. And I think Delegate Lehman, is it not also true, because I have a concern about their housing it, that they already have a grief group also staffed, I think, by University of Maryland for people who are survivors or of someone who was killed by gun violence, correct? So they've done this. This is not a unique thing for the medical examiners. Is that correct?
Yes, and what also came up in the hearing is that there's actually a unique grief support and referral program for those who die by homicide, but not by overdose or suicide, which is, they're both forms of traumatic grief, but they're unique.
Any other questions? Seeing none, may I have a motion on the amendment, please?
Move the
The amendment.
Second.
It's been moved in second. Any questions or concerns? On the amendments, all those in favor say aye.
Aye.
Any opposed? Seeing none, on the bill as amended, may I have a motion,
Move the
please?
bill.
Bill,
It's been
Second.
moved in second. Any questions or concern? Seeing none, all those in favor say aye. Any opposition? None. I want to thank Delegate Lehman for being creative, for, just getting someone else to staff it. We appreciate it, okay?
Thank you for your patience, Madam Chair. Thank you.
My pleasure. Let's go on to House Bill 1188, and I hate to do this, but we may have to come back and meet because we have to be on the floor at 5 o'clock. So let's just do 1188. They're finding out to see if the time to start has moved or not. And it's 4:36 right now, so 1188. Aaron?
There is a reprint of this bill. It might have been the start of packet 3. That's handwritten page 53. If you look on handwritten page 53, under line 25, this pulls in current law. Currently, there is a statewide steering committee on services for adults with sickle cell disease. This changes the name of that steering committee to the statewide steering committee on sickle cell disease. So all that you see under line 25, all the way down through all of handwritten 54, that's current law. So we do currently have this statewide steering committee on sickle cell disease. Moving on to handwritten page 55, this is the new language that was in House Bill 1188 that requires MDH and the amendment would be requiring MDH in consultation with the steering committee to establish and implement a system of providing information on the sickle cell trait or thalassemia trait to an individual who has the sickle cell trait or the thalassemia trait, including as determined through a newborn screen, and if the individual is a minor, to the individual's family. MDH would be required to include the following information: how the sickle cell trait or the thalassemia trait impacts the health of an individual with the trait, and how the sickle cell trait or thalassemia trait is passed from a parent to a child. The bill also requires the department to maintain in a conspicuous location on its website a list of resources for the healthcare practitioners to use to improve their understanding and clinical treatment of individuals with sickle cell disease. The bill also required the Board of Nursing and the Board of Physicians to include certain information in renewal notices. That part of the bill has been stricken. And that's the stricken language on handwritten page 56. Then if you move on to handwritten 57, it requires the statewide commission on sickle cell disease in conjunction with the Maryland Department of Health and other stakeholders to study and make recommendations on how to enhance access to services for individuals with a focus on areas of the state where there's a statistically high number of individuals with sickle cell disease and areas where there's a lack of providers with expertise in treating sickle cell disease. They would also study whether to establish a sickle cell disease registry, and if recommended, the process and guidelines for establishing a registry, obtaining information, connecting with the state designated exchange, and protecting data privacy, how to enhance the coordination of healthcare services for individuals with sickle cell disease who are transitioning from pediatric to adult healthcare in the state, including the identification of available resources for individuals who are transitioning, and how to engage with community-based health fairs and other community-sponsored events in the areas with statistically high number of individuals with sickle cell disease to provide outreach and education on living with sickle cell disease and how to access healthcare services. The statewide committee on sickle cell disease would report their findings and recommendations to the General Assembly by December 1st, 2022. There were about 4 or 5 sickle cell disease bills in HGO, if you recall, and a lot of these amendments try to incorporate pieces of each of those bills into one bill.
Pam Case-Meyer.
Yes.
Okay, we like to be heard on these bills. I know there were a lot and we tried to just consolidate them.
Yeah, and
And I'm here on behalf of the Academy of Pediatrics and MedChi and some other specialty societies. I think we listened to all of the bill hearings and understood that this still remains an issue that requires some attention. But there were some good and bad, I don't mean bad, well-intended, but provisions in the various bills that we thought were stronger or not. And some of them probably just needed a little bit more conversation, which is why we suggested that the existing committee work on some of those issues that were in the other bills to make recommendations so that if we do move it forward, we move it forward correctly. But that immediately start focusing on getting and gathering more information and making it available. So that's why we're now supportive of this bill as redrafted, because there's already the existing committee. It's renamed just because the other was only on adult care. And we also are hearing from people that transitioning from pediatric care to adult care is an issue. So we really wanted to put all the various issues before that committee in conjunction with the health department and stakeholders to come back with some additional recommendations.
And the commission, they were not meeting, right? They haven't met?
No, my understanding is that they haven't met, but some of that too is you renewed them in 2019 and then COVID hit. And I think, which isn't the reason they may not need some energy to go, but it's a pretty robust committee. I think probably a lot of things sort of fell off the radar screen during some of the last 2 years.
Makes
And I
sense.
think,
Yeah.
and I think this bill now and involving the health department in conjunction with the committee can revitalize that group and have it focus on some specific issues that were identified by the proponents in the various bills.
All right. Thank
Move the
you.
bill. Sounds great.
Wait, the amendments. All right, on the amendment.
All right, move the amendments. They sound
Anyone
great.
second? All right, great. Anyone opposed to the amendment? No. On the bill as amended, all
Yep.
those in favor
Move the
say aye.
bill as amended.
All right. Anyone, Delegate Hill, you have a question?
Yeah, my understanding from Ms. Case, I want to be clear that I'm understanding that after working on it, they are not happy with this bill or the amendments. Is that right?
Oh, no, we're supportive. We like the bill exactly as it's drafted now.
Okay,
All right.
all right. All those in favor of the bill say yes.
Yes.
Opposed,
Yes.
none. Okay, the bill passes. Does anyone know if the time has changed? Are we to be on the floor 5? Can anyone check?
It still says 5.
Okay, so
Well,
you
let's
know
keep
what?
rolling. There have been no bells.
Okay, so 1370 then, Organ and Tissue Donation Awareness Fund, Annual Funding and Extension. Erin, I love you guys. You guys are great.
The bill is introduced, required that beginning fiscal 2024, at least $500,000 be distributed annually from the Organ and Tissue Donation Awareness Fund to the nonprofit entity selected by the Secretary of Health to establish, maintain, and operate a donor registry. There are amendments in your packet starting on handwritten page 63. This mirrors the bill as its Senate cross-file has passed at least Senate B&T. I'm not sure. I know it's gotten out of committee in this form. The bill as amended would require if you go on handwritten 64, line 21 through 24, it requires the Organ and Tissue Donation Awareness Fund to consist of money collected under 16.111.2 of the transportation article, and funds appropriated in accordance with subsection C, which is on handwritten page 65 under line 12. And this is the amended language in the bill requiring that for each of fiscal years 2024 through 2027, the governor would include in the annual state budget an appropriation to the fund equal to the difference between the funds that are already collected for the fund under 1611.2 of the transportation article in the second preceding year and $500,000.
Okay, does anyone want to be heard on this bill quickly? Okay, Delegate Shalega has a question.
Thank you. It looks like handwritten 65, line 6, the current language is 400,000. This is increasing it 100,000. Do we know how much they currently collect?
Yeah, it's in the fiscal note. It says they currently receive revenues of approximately $120,000 annually.
Didn't we have this bill last year?
No,
I remember talking
this,
about this.
we had this bill years ago. I put it in initially, many years ago. I'm almost positive.
And they're going to give this $500,000 to an outside group that MDOT will choose.
No, it's the same group that hasn't changed. All this bill is doing is continuing the current funding mechanism and the current group that receives the funds, but then it's raising that amount from $400,000 to $500,000.
All right, I'm going to go look at the fiscal note to see if do we ever get an audit of that? I mean, how much does the person who heads that up make?
I don't know that information.
I don't know, but the Secretary of Health is the person actually that contracts with a nonprofit. And the Secretary of Health is the one that does the selection. And this has been the nonprofit that we have been working with. I don't have anything.
There's people on the call who represent. Yeah.
Where are they?
Madam Chair, Isaac Meyer, Compass Government Relations.
Okay, could you answer the delegate's question, please? Delegate Shalega, can you ask your questions, please?
Yes, I'd like to know, I mean, first of all, why isn't the fund paying? I mean, when it was set up, I thought it was supposed to be self-sustaining. So, you know, where does the money go and what accountability do they have for how much they spend on specific items?
Yeah, so on behalf of Donate Life Maryland, just for the record, the money has been flat funded at $400,000 since inception, based on Delegate Pena-Melnick's legislation from, I believe it's 2009, I want to say. But as far as what this additional $100,000 would go to, right now, all the money from that goes to Donate Life Maryland is spent for marketing, the flyers you see at the Maryland Vehicle Administration, as well as different projects that go out in the community where there is not a lot of organ donation, to build awareness of organ donation. So that's what the money goes toward.
Yeah, didn't we have a bill? I remember you coming and talking to us.
Yeah, last session we made a change to how you register based on your eye and tissue versus your organs and things like that. That was a much different issue last year. And it had nothing to do with funding last year.
Okay, and so all the money that out of this that goes to your organization pays for printing of pamphlets and whatnot.
All of that, and
who pays for your salaries?
For years.
Who pays for your salaries?
I believe some of the money does go towards salaries, because this is literally about 90% of the organization's funding. They do get some funding from the organ procurement organizations that serve Maryland, like the Living Legacy Foundation and Washington Regional Transplant Center. But yes, the money from this would go towards salary, of course.
And how many people work in your organization?
I don't have the numbers on how many people work for that organization offhand, but I can get that information to you, Delegate.
Delegate Spiga. My name is Lisa Spickle. I'm the Executive Director with Donate Life. I am the only employee for Donate Life.
There you go.
Okay, so there's one employee and then the rest of the money goes for printing material. Do we ever see your budget?
I'm happy to share the budget with you.
The
money goes to public education and outreach. It also goes to maintaining the organ donor registry. So we are solely responsible for maintaining the maintenance of the registry and all the funds that are associated with that as well.
Okay, that sounds reasonable, but in you know, as a steward of public money, I would love to see your budget, and you know, that way we'll know that we've done our due diligence. Thank you.
Happy to get that.
Can you send us your budget? Can you do that today, please?
Yes, ma'am.
We're gonna vote on the bill, but you need to send us the budget, okay?
I will do
and
that.
I forgot about that you do maintain the organ donation registry. The bells rang. So on the
There's a bell.
On the amendments, may I have a motion,
Move
please?
amendments.
All right, we've been moving second.
Second.
Any questions or concern? Seeing none on the bill as amended.
Move the bill as
and-
amended.
Can I
Second.
have a second? All those in favor say aye. Any opposed?
I'm going to provisionally vote yes, and I'm going to trust Lisa, but look for her budget to ensure my yes vote in full committee.
Thank you, Delegate Szeliga, for the trust. Thank you so much, committee members. We do have 1381 and 1389 left. For those of you that were waiting for it, you know, we have to be back on the floor, but we will meet again and get through those two bills. Pay attention to the time that we're meeting. Thanks again for your patience and your flexibility. See you on the floor.